Hey everyone, welcome back to Shivali's Tooth Treasure. Today we're diving into the fascinating world of dental restorative materials. Whether you're a dental student or just curious about what goes into these materials, you're in the right place. First up, let's talk about amalgam. Amalgam has been used in dentistry for over a century. It's a mixture of metals, including silver, tin, and mercury. One of the biggest advantages of amalgam is its durability. It's incredibly strong and can last for many years. However, the downside is its appearance. Its silver color makes it less aesthetically pleasing, especially for front teeth. Also, there's been some debate about the safety of mercury, although many studies have shown it's safe for use in dental fillings. Next, we have composite resins. These are tooth-colored materials that blend in perfectly with your natural teeth. They're made of a plastic resin and finely ground glass-like particles. The main advantage is their aesthetic appeal. They look just like your natural teeth. However, they're not as durable as amalgam and can wear down over time, especially on biting surfaces. Another thing to note is that they can stain over time, just like natural teeth. Moving on to glass ionomer cement. This material is often used for fillings in children or for small cavities in adults. It's great because it releases fluoride, which can help protect the tooth from further decay. However, it's not as strong as composite resins or amalgam, so it's not suitable for areas under heavy chewing pressure. Now, let's talk about gold alloys. Gold has been used in dentistry for a very long time, and for good reason. It's extremely durable and biocompatible. That means it's very unlikely to cause any allergic reactions. The main drawback? It's expensive and, like amalgam, not very aesthetically pleasing. Finally, we have ceramic materials. These are often used for crowns and veneers. They're incredibly aesthetic and can be matched perfectly to the color of your natural teeth. They're also quite durable and resistant to staining. However, they can be brittle and may fracture under heavy pressure. All right, now let's sum it up with some indications and contraindications. For amalgam, it's great for posterior teeth where appearance isn't a major concern, but avoid it in patients with metal allergies. Composite resins are perfect for anterior teeth due to their aesthetic properties, but be cautious in patients with high caries risk, as they may not last as long. Glass ionomer is ideal for pediatric patients or small fillings in low-stress areas. Avoid it in high-stress areas like molars. Gold alloys are excellent for patients requiring durable restorations and who don't mind the cost or appearance. Ceramic materials are best for crowns and veneers in aesthetic zones, but avoid them in patients with heavy bruxism. And there you have it. A quick rundown on the various dental restorative materials, along with their pros and cons. Remember, always consult with your instructor or a licensed professional before using any of these materials. If you found this video helpful, don't forget to like and subscribe to Shivali's Tooth Treasure for more dental insights. Thanks for watching, and I'll see you in the next video.